So welcome, Jean. This is Jean Kelly from Eglinton Eyecare. Jean has quite a wide range of experience with talking to schools and the communities and raising awareness around eye health with children. So, Jean, would you like to just give a short introduction on how you approach this, please?
Yes, well, we have been engaging with schools now for probably about 15 years and delivering workshops and presentations to the schools. And it's something that we haven't really had to try to work too hard at. It's something that I enjoy. I think being an eye health professional in the community, it gives us an opportunity to give something back. The community support us really well, and it's our opportunity then to give back and educate children and parents on the importance of eye health. I think there's actually quite a large gap of information for parents to understand why it's important to take their children to the opticians regularly. They seem to understand and be very aware of dental health for their children, but there really isn't a lot of information from either the education authorities or the health service about the importance of regular eye health. And vision and learning go very much hand in hand, good vision and ability to learn. So I think it's my responsibility as an eye care practitioner to educate the local children and families about the importance of coming in for regular eye exams from a young age, so that if there is any issues with vision, that early intervention can make a big difference to their visual development as well as their learning ability.
So, Jean, in terms of the process of getting the message out into the community via the schools, do you have a step-by-step plan? I mean, what approach do you take?
Well, first of all, I would contact the school, usually by phone, introduce myself and explain to them what I'm offering them, position myself as the eye care expert or the local optometrist, however people want to position themselves. And then just tie it in usually with some sort of national eye health date in the calendar. There are lots of dates throughout the year that you can kind of tie into your talks. There's National Eye Health Week, there's World Sight Day, there's Self-Care Day, there's a Children's Eye Health Month. There's lots of dates in the calendar that you could tie in your presentation to and make it a reason for going to the school that week. And that keeps the principal more interested in wanting to have you in the school. Schools often also have a health awareness week or a self-care week, or they have a date in the diary like a science week potentially, some week in their own diary that they might want you to come into the school during that week. So that's another good time to offer your services. And once the school are interested, I kind of find a date in my diary that suits me and also suits them. And I let them know that I'll be there for about an hour. I try and plan it around coming in after the children's either break or lunchtime so that they come in fresh and they're ready to learn and they're always eager to see you in the classroom. Try not to pencil it in just before lunch in case you run over and the children's lunch bell goes and they're dying to get to lunch and don't want to listen to you. I suppose give the teacher an idea in advance of what it is you're delivering and find out if you're covering everything that they want you to cover. I'd find out how many children in the classroom, what's the teacher's name, what's the principal's name, what's the secretary's name, have all that information ready in advance. And also actually I use it as an opportunity not just to visit that classroom and give information to that classroom or that year group. I always ask the principal if it's okay to bring a leaflet for all children in the school. So I like to give out a leaflet so that all families in the school have some information at least once a year about the importance of bringing their children in for an eye test. So at least once a year you're reminding every parent in the school about coming in for an eye test. And often the schools are quite happy to put a little mention in their newsletter that you've been in and that there has been a leaflet sent home if they could take a look at it. And you're not really asking them to come to you necessarily. You're asking them to take their children to the optician, whoever their optician is. But it's likely that having gone to the school, they will trust you as the expert in the community and bring their children to you. And the knock-on effect of that is obviously of finding children who need help, who haven't got a visual correction, who need a visual correction, and also the commercial benefits to the practice.
Great, sounds great, Jean. And once you're in the classroom, and what's the process when you're in the classroom? You know, how do you pitch it? What kind of visual aids do you have, and what do the children take away after the talk?
Well, first of all, I suppose it has to be fun and engaging, eye contact, smiling. I like to kind of move around the classroom a little bit when I'm doing my presentations, so I have a little clicker. I think it's great to have that instead of having to just stand beside your computer and move every slide on. Move around the classroom. I bring props with me. I bring things from the consulting room. I try to make the children aware that it's not a scary experience to come and get your eyes tested. So if they've seen some of the things that they'll be asked to do in an eye test in advance, it often alleviates a little bit of fear whenever they do come in, or anxiety that some children will feel whenever they come to get their eyes tested. So I take with me like a large eyeball, a model eye, because sometimes explaining the parts of the eye on a flat 2D picture doesn't make a lot of sense to a child. If you've got a physical eyeball that you can take apart and show them all the little bits and explain what the little bits do, that works really well. I take my 3D test with me because they like trying on the 3D glasses. I take my colour vision test with me. I take an A4 letter chart as well as a picture chart with me. And I take, actually, because we talk about Braille within the lesson, so I take with me medicine boxes with Braille on the side of them. I ask the children, does anybody have any Braille at home? And they generally say no, because they don't realise everyone has Braille in their own homes on the side of their medicine boxes. So they love to come and tell their parents, oh, mommy, can I see the Calpol box? Look, we've got Braille on it, because the optician has been in today and told us all about this. And I actually usually borrow a Braille book from the library. That's quite useful as well, because the children love to see what Braille actually is in real life. It's all good saying it's like 6 raised dots, but what it actually looks like in real life in a book form is different. So children love hands-on. They like to see physical things that they can touch and feel. So that's what I find the props are really, really useful in the classroom. You'll find that some of the children in the class would be more eager to answer and more eager to jump up and take part. So trying to, I suppose, encourage all the children to take part, ask them just to put up their hands whenever they're ready to answer a question, ask them lots and lots of questions before you put the information on the board behind you. Ask them, when did they last have their eyes tested? Who wears glasses? What is colour blindness? What foods are good for your eyes? Why is it important to look after our eyes? How can we protect ourselves in the sun? How do people with poor vision read or see? So all those kind of questions, get them to put up their hands. And the quieter children, you'll always find there's a table that don't answer out as much. So you can walk around and you can ask them directly, what do you think? Have you had your eyes tested, or whatever the relevant questions are? Give them some easy questions to answer. And always get the teacher. Usually I take with me another member of staff. So there's 2 pairs of hands with me, and then you might have the teacher and a classroom assistant. So when you're working through some of the exercises or some of the games, you can kind of ask the teacher and the classroom assistant to help out on some of the tables as well.
Great.
Those are kind of generally the things I would do when I'm in the class.
Thank you, Jean. And then in terms of kind of core messages, what do you talk to the children about specifically, or is it eye health in general?
Well, we would look at the parts of the eye. We would look at what happens in an eye test. We look at what foods are good for their eyes. We talk about the difference between long-sightedness and short-sightedness and astigmatism. We look at Braille. We look at what would happen if you didn't have good vision. So we do some games afterwards. We have our presentation. We work through a workbook of lots of little exercises they can do, and then we have games at the end. So we might have games where we blindfold the children, so that they're kind of experiencing what life would be like without good sight. And we have a bag of little objects that they would find in their own home. It might be toys, it might be cotton wool, it could be a toothbrush, it could be anything. And they put their hand in and take something out, and they try and guess what it is. So those hands-on games are really valuable. So those are the kinds of topics we cover whenever we're in the classroom.
Great. And then for the children, is there a take-home? Is there something that you give the children to take back, maybe to the parents?
Yes, well, we do have the workbook that they work through in the classroom that I've designed has some augmented reality through the workbook, which means the augmented reality part of it means that the videos and the images can come to life with the help of an app, and voices can be interacted with that. So if the parent downloads an app on their phone or their tablet, the children can watch the pages, the videos with the bears. There's 3 little bears throughout the workbook, and they can listen to the bears talking and telling them the key messages of getting their eyes tested, of wearing their sunglasses in the sun, of eating healthily for their eyes, of how much fun it is to pick glasses. Those key messages are all kind of within the workbook. So they take the workbook home. The parents get involved. There's a nice parents section at the start of the workbook, so it gives the parents lots of information about why it's important to get their eyes tested. And there's a competition page near the end of the workbook which the children can complete with their parents, and they can bring it into the practice and give us a chance to engage with those families whenever they do come into the practice. book eye tests for any members of the family that are due. So, and then we also give them a goodie bag to take home with them as well. They really love their balloon or their pencil or their sweets or whatever we put together in a little goodie bag for them. That's kind of that's the bribe at the start of the class, at the start of the lesson. Whoever be good during the lesson will get a goodie bag at the end.
Sounds great. Very, very fun, informative. I mean, if there's, one of our listeners considering this, what would you say to them?
I'd say to them, go ahead and do it. Some people might have thought about doing this for a long time and have been put off by the fact that they have to put a presentation together. They have to think of a lesson plan. But this is all done for you. Hoya have this all ready to go. It's a ready-made package. The PowerPoint presentation is fabulous. It's of a much higher quality than anything that I could put together. If I had these resources when I was starting out, it would have helped me a lot because I spent lots of hours and hours trying to fine-tune mine and get mine perfect. And they've got the digital resources, the letter for the teachers. It's all there. It's a very simple, easy to walk into process now for anybody who wants to take part. And if you actually are already engaging with schools and you're ready to have a presentation and you're ready to do presentations with the children, I think you'll still find plenty of what Hoya have to offer through their resource pack will complement what you're already doing. So it is fun. It is something different. If you take a member of staff with you, it gives that member of staff the opportunity to step outside their comfort zone, learn some new skills with presenting or communication or planning the activity or delegating. So lots of learnings and personal development for the team member. If you maybe give this role to a team member to take out to schools rather than the eye care practitioner themselves. Some people might think it's going to take time out of clinic. It doesn't have to take time out of clinic. Sometimes the best person to deliver these presentations is not the optician. It could be maybe one of your dispensing assistants or optical assistants. Anyone who has a bit of energy about them and enjoys engaging with children is the best person to deliver.
So Gina, in addition to raising awareness around eye health and your practice within the community, what other benefits would you say this approach brings?
Well, it definitely raises awareness of and your profile within your community, but it also you'll definitely get the guarantees. I suppose is you'll definitely get more children coming to your practice. You will raise the demographic of children who come to visit you. You will find more children with eye-related issues that are uncorrected. You'll find those children who have reading difficulties. You'll find those children who have the beginnings of myopia. It gives you the opportunity then at that stage to intervene at a nice early stage for those children who have myopia. If you are engaging with some myopia control products, it'll help you build that demographic of your myopia management patients. So it has definitely got a commercial benefit as well as a nice thing to do and the right thing to do. I think as eye care practitioners, we are positioned in the community, and it's our responsibility to inform parents and inform families of the importance of eye care from a young age. So it's not only is that a nice thing to do, but it also has that commercial benefit. And as I said earlier, it has personal development for your team members that you take with you, or the team members who deliver the presentations within the school. They are easy to do, they are fun, and you will get the rewards of it back. It will definitely help grow your practice.
Thank you.